1 in 5 people will live with mental illness, and Mecklenburg County residents believe support for those issues is the most underfunded public service.
Despite that, the mobile crisis team that helps thousands in distress from potentially harming themselves recently had funding slashed. Channel 9's Joe Bruno spoke to members of that team, and he joins us now live with their call so they can get that critical funding back. Joe?
Well, that change in funding is one of the reasons why Mecklenburg County is considering severing ties with Cardinal Innovations. Many of these calls are life or death, and because of that change in funding, there are fewer people answering the phones and less clinicians to go out on calls.
Mobile Crisis, this is Ginger.
On the other end of the line is someone who needs help.
One of the worst days of their lives that they're reaching out.
Within minutes, a dispatcher from Mobile Crisis is able to tell a clinician about that person's condition.
And having some thoughts of harming herself.
So they can hit the road and provide assistance.
Our primary goal is hospital and jail diversion.
Mobile Crisis President Keisha Ginn says that Cardinal changed their funding. Because of that, since December, they say there were 52 people who weren't able to be helped. Earlier this week, Cardinal CEO Trey Sutton told me they gave Mobile Crisis $1.3 million last year, and the nonprofit was only able to produce claims for $250,000 worth of services.
It makes you wonder, where is the rest of that money going?
For someone to kind of cast aspersions about where did that money go is kind of shocking.
Fred Chanteau is the CEO of the parent company of Mobile Crisis and was disheartened by Sutton's comments. He says Cardinal used to contract with Mobile Crisis but changed to a fee-per-service model. He says the billing would never be equal to the total amount of the contract.
If I were in his position, I guess I would probably have also tried to deflect attention from what was going on.
The funding cut by Cardinal means Mobile Crisis now only has 3 clinicians instead of 8 and only 2 phone counselors instead of 7.
No one in this community can afford to have this critical service not operate at full capacity.
Despite the strained relationship, Mobile Crisis isn't taking a position on Cardinal's future with Mecklenburg County. If somebody calls the hotline and is in crisis and there are no clinicians available, Mobile Crisis is referring people to the emergency room. Erica?
Yeah, we've done so many special reports about the importance of mental health. We know this is a critical service for our community, so thanks for shedding light on this aspect of it, Joe. As for that dispute, though, between Cardinal and Mecklenburg County, if they want to replace Cardinal, if commissioners want to do that, the county would have to get approval to do that from the Department of Health and Human Services and give a 9-month notice.